composite resin is a tooth-colored filling. Of course, there's some things that are repeatable. Always want to protect the patient's eyes with their protective eyewear. Always want to put a bib on to protect the clothing. And remember that the composite resin comes in a more runny or flowable version and a harder or a packable version. Okay? Guess what this is? The basic, featuring again. Now look at the top of this bag. It has dark stripes. These dark stripes are similar to that gray button I showed you at the top of the other package with the sterilized handpiece. So you can actually have a mark on the bag, or you can use specialized tape that gives these dark stripes once the things have been sterilized. So we know immediately as we pick this up, this has been through the sterilizer, right? Our basic. We often have to give a little anesthesia. We're going to use a syringe, and on top of the syringe goes a needle. 2 different sizes. The blue is the short, the yellow is the long. Okay? And this is topical anesthetic that we use before we inject. And what else do we have here? We have the flowable composite, and we have the packable composite. You've seen these before. And we have the etchant, which you've seen before. And we call this the caries indicator. Now, I want to make sure that all the decay is gone. So if I've finished removing it with my high-speed handpiece and my burr, remember, then I can use a little bit of this and it will stain any disease that remains. So I can have a visual marker as to what I need to remove. So let's go through a couple of things. First, we're going to protect the patient's eyes. Then we're going to protect the patient's clothing. And as the patient is seated and we know that they're going to get anesthetic, we put some topical anesthetic right by the area where we're going to give some anesthesia with the needle so that this numbs the area. So once we put that on, then the next thing that we'll do is use the syringe and the needles, whichever one we're choosing to use, to put on top of that syringe to give anesthetic. So the patient is quite comfortable while the procedure is being done. And then after we have anesthetized the patient, gotten them numb, we will use our friend again, the high-speed handpiece with burrs, cutting instruments to remove the dental disease. Oops! And once we've removed the dental disease, then I'm going to use the etchant to prepare the tooth. Well, actually, before I do that, I will use my caries indicator to make sure I've gotten rid of all the disease. Then I'd use my etchant to prepare. And then we use a bonding or a glue, the adhesive. And once we're done with that, we have the filling material, flowable, packable. Sometimes we use one or the other, or sometimes we use both. And then after we finish doing all of that, we're going to polish. And so we have polishing tools. Let me show you. I think I showed you them before, but let's show you them again to get that composite nice and shiny. Remember, we went from dark to light. Just as how we use sandpaper, we use a coarse grit to the finest grit. The darkest color polisher has the most coarse grit. And the lightest color polisher has the finest grit. And then once we've done that, we have to check the bite to make sure it's not high. So this is my articulating paper that I use to check the bite. There are a couple of steps that I've left out, but I'm trying to make it not too complicated for you. So review, and review. As you can say, a lot of what we use for the sealants, we use for composite resin. So we're just kind of adding on.